All right, let's dive into some research coming out of southern India. It's a study on inherited lipodystrophy syndromes, LS for short.
You might be thinking lipo what, but this is about a lot more than just a rare disease.
Yeah, we're going to be uncovering some surprising stuff about how our bodies store fat
Hmm.
and what happens when things go wrong.
One thing that really caught my eye is this research suggesting that a type of LS familial partial lipodystrophy, or FPLD, could be way more common than we thought, maybe even 1 in 7,000 people.
Wow, that's it. I always thought these syndromes were much rarer.
Right, and that's why this deep dive is so important. If it's impacting that much of the population, understanding it becomes crucial.
Okay, so what exactly are inherited lipodystrophy syndromes?
Simply put, LS involves a lack of adipose tissue, which is just body fat. But the key here is this isn't about someone just being thin or dieting, it's genetic. Their body just can't store fat normally.
So the bodies are like wired differently when it comes to fat.
Exactly. And that can set off a whole bunch of health issues. When your body can't store fat properly, it builds up in other places, like the liver, muscles, and pancreas.
And that's when things get serious.
That's when things get
The
serious.
study mentions there are different types of lipodystrophy, right?
Absolutely. You've got congenital generalized lipodystrophy, or CGL. It's the most severe form, a total body fat deficiency, basically from birth. Then there's FTLD, which we already talked about, where the fat loss is partial and develops later.
Got it. So this research out of southern India, what were they looking at?
They use next-generation sequencing, that's a pretty advanced genetic test, to analyze a group of 29 patients who might have LS.
Okay, and what did they find?
Out of those 29 people, 8 had mutations in genes linked to LS, 3 with CGL, and 5 with FPLD, a mix of both types.
That's fascinating. Adding data from a region where we don't have much research on LS.
Exactly. And as we get into their findings, you'll see why it's so significant. It challenges what we thought we knew about LS.
All right, well, don't leave us hanging. What did they find?
One of the things that really stood out was the gender difference. 7 out of the 8 patients confirmed with LS were women.
Huh. Is there a known gender bias with lipodystrophy itself?
Not in the syndromes themselves, no, but the study authors think we need to look closer at FPLD and how it impacts women. There's some research suggesting women with FPLD could have more severe metabolic complications.
So not just about having it, but how it plays out in men and women.
That's one of the questions this study asks. It points to the need for a more personalized approach to how we diagnose and treat LS.
Speaking of diagnosis, the study mentions that pinpointing LS can be tricky. Why is that?
Well, you might think that with lipodystrophy, you just, notice a lack of body fat, but it's not always that easy.
So it's not just about looking at someone's appearance.
Exactly. There are other conditions that can cause fat loss. Plus, the severity and location of fat loss can vary a lot. You can have 2 people with the same type of LS, and they might look totally different.
Okay, so how do doctors diagnose LS then?
The Endocrine Society suggests a multi-pronged approach, starting with a full patient history, including family history.
So looking for red flags in their background.
Yes. And then there's a physical exam to look for characteristic signs, but it goes beyond what you see. Doctors also have to look at the patient's body composition, things like body fat percentage and distribution, using scans like DXA scans.
So looking for fat loss in specific areas.
Yeah. And of course, they need to check the patient's metabolic health, things like high blood sugar, triglycerides, and liver enzymes.
It's like detective work, putting all these clues together.
It is, but there's one tool that's becoming more and more important. To confirm the diagnosis, genetic testing.
So that's how you really get to the bottom of it.
Definitely. Genetic testing can pinpoint the exact mutations causing the syndrome, so you can go from a general diagnosis to a more precise understanding.
I see. This study also found some surprising things about how patients responded to treatment, right?
Yeah, that's where it gets interesting. You see, lipodystrophy often leads to really bad insulin resistance, meaning patients need high doses of insulin to control their blood sugar. But in this study, 1 patient with CGL and 4 with FTLD had good blood sugar with just oral insulin sensitizers.
Wow, that's surprising, especially for the CGL patient, right?
Exactly. It makes you wonder if some types of LS respond better to certain therapies than we thought. This could change how we treat LS.
So it's not just about diagnosis,
Yeah,
but figuring out the best way to manage it for each person.
precisely. And this study gave us a look at that personalized approach. They visualized fat distribution using DXA scans.
Wait, you can see how fat is spread out in the body?
Yeah, it's pretty cool. And the images showed some surprising things. For example, All 3 patients with CGL had some fat in their head and neck, which you don't usually see with CGL.
So even within the same type, there can be differences.
Absolutely. It shows how complex these syndromes are. And it gets even more interesting with the FPLD patients. Those with mutations in the LMNA gene had fat in their face, neck, and above the collarbones, which gives them a sort of pseudo-Cushingoid look.
So those physical signs could point to LMNA-related lipodystrophy.
Yeah, like another piece of the puzzle. And then there was one patient with a PPRG mutation who had a totally different pattern. Fat loss in the limbs and buttocks, but not the face and neck.
Wow, so many variations. Seems like there's a lot we still don't know.
There is. And this study shows how much more there is to explore. It's challenging our assumptions and pushing us to look deeper into personalized medicine. And, we talked about genetic testing. Well, they didn't just use it for diagnosis.
Oh, right. They looked at family screening too, didn't they?
Yeah. And the results were really interesting. One patient with CGL had a specific mutation in a gene called AGPAT2. And when they tested her parents and sister, they all had one copy of that mutation too.
So they were carriers, even though they didn't have the syndrome.
Exactly. That kind of knowledge is super helpful for family planning and understanding risks for future generations.
It's amazing how genetic testing can do that.
It is. In another case, a patient with FPLD had a mutation in the LMNA gene. Her mother had the same mutation and had a similar presentation of the syndrome.
So the mother might not have even known she had LS.
That's right. This highlights how important family screening is to find people who might be affected without knowing and get them the care they need.
I see. Now, we've covered a lot, but there's one more finding I want to highlight: hepatic involvement.
Right. This is a big one. 7 out of 8 people in the study had either hepatic steatosis, which is fatty liver, or chronic liver disease.
That's a lot. What does that mean?
It means we need to think about LS when we see patients with young onset diabetes, especially if they have liver problems, and a low or normal BMI.
So it's a reminder for doctors to consider less common diagnoses.
Exactly. Early diagnosis and treatment are key in managing LS and preventing complications. This study gives us valuable insights to help do that.
This has been really eye-opening. I'm seeing LS in a whole new light.
Me too. And there's even more to talk about as we continue our deep dive. Stay tuned as we explore what this means for personalized medicine. One thing that really struck me was how this study challenged the idea of lipodystrophy as a one-size-fits-all thing.
Right. It's not just you have it or you don't. There's a lot of variation.
Exactly. This research really showed that, especially those atypical presentations.
Like those CGL patients with fat in their head and neck, which you wouldn't expect.
Exactly. Or that person with the PPARG mutation and the unusual pattern of fat loss. It's like each case gives us another clue, helping us understand the nuances of LS and how different genes can change things.
It makes you wonder if there could be even more subtypes of LS out there.
That's a good question. And this research definitely makes us think about that. It shows that doctors need to be aware of these subtle differences and not just rely on textbooks.
So think outside the box. Yeah. Not every patient will fit neatly into a category.
Right. And this study also showed how important genetic testing is, not just for the patient, but for their families too.
Because knowing someone's specific gene mutation can affect their relatives.
Right, exactly. It helps family members understand their own risk and make decisions about their health. It gives them knowledge that can lead to early detection and treatment, which can be really important.
It's amazing how much genetic testing is changing things.
It really is. And as we learn more about our genes, we can expect even more personalized healthcare in the future.
I think one of the most interesting things from this study was those unexpected responses to treatment.
Oh, yeah. The fact that some people with CGL and FPLD had good blood sugar control with just pills was really surprising.
Especially for the CGL patient. That's not the usual response.
Right. It makes you wonder if there are subgroups of LS that respond differently to treatments.
It makes you think, what if we could tailor treatments based on someone's genes?
That's what personalized medicine is all about. And this study gives us a glimpse of that. If we can figure out who responds best to which therapies, we can treat them better and maybe avoid stronger interventions.
It's about moving away from that one-size-fits-all approach.
Exactly. And this research also showed how important it is to look at the whole picture when diagnosing.
It's not just about fat loss or genetic testing, right?
Right. It's about the patient's history, their physical exam, their body composition, their metabolic status, and then using genetic testing to confirm and find the specific mutation.
Like solving a puzzle, using all the pieces.
Exactly. And this is especially important. In places where genetic testing isn't readily available, doctors can still make a good guess based on clinical features, and then refer for genetic testing if possible.
It sounds like this study is a wake-up call for both researchers and doctors to dig deeper into lipodystrophy.
It is. We still have so much to learn, but every discovery brings us closer to better diagnosis and treatment, and ultimately improving people's lives.
I think one of the coolest things was how they used DXA scans to actually see the fat distribution.
Yeah, those images were amazing. Remember how we talked about those variations in fat distribution? Well, the scans show them clearly.
Like those CGL patients with fat in their head and neck.
Exactly. Or the people with LMNA mutations, who had that fat in their face and upper body, giving them that pseudo-Cushingoid look.
Right. And then there was that person with the PPRG mutation who had fat loss in their limbs, but not their face. It's incredible how much detail those scans can show.
They really can. And that information isn't just for diagnosis. It helps us understand the disease itself and how different genes cause these different presentations.
It makes you realize how complicated fat regulation is.
It really is. And this study shows how important it is to keep researching. Who knows what else we'll find? Maybe even more subtypes of LS are out there.
Now, about that hepatic involvement we talked about, I think it's worth another look. It was a big finding in this study.
Yeah, definitely. The fact that most of the participants had fatty liver or liver disease shows the strong link between LS and liver health.
It's a reminder that these syndromes can affect many organs.
Right. And it shows how important it is for doctors to monitor liver function in these patients. Early detection and treatment can prevent problems down the road.
I think one of the main takeaways from this deep dive is that LS is more complicated than we might think.
Absolutely. It's not just about a lack of body fat. It's about the genetics, the different ways it presents, the potential for personalized treatment, and the importance of family screening and comprehensive care.
This research has given me a new perspective on LS.
Me too. And it shows how much more we need to learn. But one thing's for sure. The future of LS is in personalized medicine, tailored to each person's genes and how their condition shows up.
This deep dive has been so insightful. Before we wrap up, is there anything else our listeners should know?
I think the most important thing is to keep learning and asking questions. This is just one piece of the puzzle. As we learn more about genetics and personalized medicine, we can expect more exciting discoveries that will change how we understand and treat LS.
This deep dive has been really something else. We've gone from the basics of inherited lipodystrophy syndromes all the way to this groundbreaking research from southern India. As we wrap up, what are the big takeaways for our listener?
It's amazing how much this research has really changed how we think about LS. We started by saying it's often seen as a rare disorder, but now we're realizing FPLD could be much more common than we thought.
Right. It's like,
Yeah.
you think something's just a niche topic and then you find out it could be affecting so many people.
Exactly. And that's why it's so important to keep studying these conditions, because it's not just about the numbers. It's about how LS can really change people's lives.
Yeah. All those health issues we talked about.
Yep.
Like diabetes, liver disease, heart problems. LS can affect almost everything.
And that brings us to another key point: personalized medicine. This study really showed how important it is to tailor diagnosis and treatment to each person's genes.
Right. Moving away from that one-size-fits-all idea.
Exactly. And we saw that in so many of the findings, like those people who responded well to those pills. That's a big win for personalized medicine.
Imagine if we could know in advance who would benefit from a certain treatment just based on their genes.
That would be amazing. And this study also used those DXA scans to see fat distribution in a whole new way.
I know that was fascinating, seeing how the scans showed all those subtle differences in fat distribution.
Those differences are really important. They can help us diagnose and maybe even find new subtypes of LS.
It's like we're putting together a giant puzzle.
Exactly. And as we get more pieces, we'll understand more and more.
We can't forget about family screening either.
That's right. Genetic testing isn't just for the patient anymore. It can help their whole family.
Like knowing if you carry a gene mutation, even if you don't have the syndrome yourself.
Exactly. It helps people make informed decisions about their health.
This deep dive has really opened my eyes. I see fat regulation in a whole new way now.
It shows that something as basic as how our bodies store fat can affect our whole lives.
Before we go, is there anything else you want to leave our listener with?
I think the big question is, are we just scratching the surface with LS? Could all those unusual presentations and responses mean there are more subtypes out there? I think this study has opened up so many possibilities.
It's like we have a map.
Yeah,
and now we need to go explore.
Exactly. And I hope our listeners are inspired to keep learning and asking questions. The more we know about LS, the better we can help people.
Well said. It's been great having you on. Until next time, everyone, stay curious.